I'm Frank Ski of V103 and the Frank Ski Foundation. It is my pleasure to serve as your MC this morning as we host our Fulton-DeKalb Hospital Authority's 6th Annual Health Summit. This morning, we have a number of issues we will deal with, but right now, I have the honor of introducing Fulton-DeKalb Hospital Authority Chairman of the Board of Trustees, Mr. Tommy Dortch. For many, he needs no introduction, but for those of you who may not know, Mr. Dortch is a living legacy in our Atlanta community. There are many people, even leaders, who have great oratory. They inspire and they are needed. Mr. Dortch, on the other hand, is one of those rare individuals who not only talks the talk, but he walks the walk. Help me to welcome to the stage Mr. Thomas Dortch.
Good morning. While we're waiting for everyone to work through this great Atlanta traffic, we have over 1,000 people who registered for this conference today. This is our 6th year. And 6 years ago, we didn't know if people would turn out as we tried to ensure that we had communication and dialogue about health challenges in this area. The Fulton-DeKalb Hospital Authority was created 75 years ago by an act of the Georgia General Assembly with the charge of ensuring that in Fulton and in DeKalb County, we worked to make sure that there were healthy communities. And while we own the Grady Memorial Hospital system, and while we worked and now we have 125 years of Grady, it is one of the most phenomenal institutions you will find anywhere in this country. We are the largest safety net hospital in the southeastern region. We're the 5th largest safety net hospital in the United States. And Grady is not just a hospital that sits around and just to survive. With our stroke center, we have one of the best stroke centers in the nation. With our HIV clinic, we're helping to ensure that the spread of HIV and AIDS is stemmed in this city. Because if we get citizens and people who know their status and they come to us, we can ensure that with our medical support and with the cocktails that we provide free of charge at this center, they can't infect anyone else. And while there's not a cure, we can stem the infection rate. And by the way, over a year ago, Atlanta was rated the #1 city in the nation for new infections for HIV and AIDS. And so my colleagues from the Fulton-DeKalb Hospital Authority and with all of our colleagues at the Grady Health System and the 35+ community-based organizations that we fund and support, we're trying to ensure that this community will be healthy, ensure that in this community, if you have a health need, we will provide for it, no matter what Congress attempts to do and the President and those attempt to do with the Affordable Care Act. Grady has always been there, and Grady will continue to be there for this community and for the people that we serve. And so we want to thank all of you for your support. We want to thank the Fulton and DeKalb County Commissions for their years of investment in the Fulton and the Grady Health System. So I'm going to get out of your way. We have a robust program for you today. Today we want you to spend time. We want to make sure that you learn all that you can, that you go back to your communities and you share, because it's communities and people who will make the difference. We have the best doctors, but we don't want to see our citizens in Grady. We want to make sure that they stay healthy, but if they need a hospital, if they need a health system, if they need our clinics, we will be there for them. So I'll introduce my colleagues later as the program goes, but on behalf of the Fulton-DeKalb Hospital Authority and our phenomenal staff, we want to thank you. And of course, get engaged, get involved, and before you leave, right down the hallway, we have a health screening room. And we want you to come and get your exams, get tested, because if you know what your challenges are, we can guarantee the doctors will take care of you. Thanks for coming out this morning.
So let's present the candidates.
So we're going to start. We're doing this in alphabetical order. Please welcome Peter Amon, John Eves, Vincent Fort, Wanza Hall,
Keisha Lance Bottoms, Caesar Mitchell, Mary Norwood, Michael Sterling, and Kathy Woolard.
So, Alexis, as the candidates are coming up, if you don't mind, let me just make a couple quick remarks about how we've discussed we want this to unfold today. Clearly, we have a stage full of candidates, and everybody is here because this race has generated such enormous interest, and we do want to give them all a chance to answer the questions that have been put together by the Fulton-DeKalb Hospital Authority on the basis of things that matter to them. We're going to have to sort of play traffic cop. We would love to give each of them as much time maybe not as much time as they want, but we're going to have to keep things moving. So I've agreed that when a minute is up, I'm going to sort of play the bad guy. I'll try to signal you to move on to the next person, but please forgive me if I sometimes seem to be rude. I don't mean to be. I just want to make sure you all get a chance to comment on the questions.
All right. So we're going to start again. I said no opening statements, but you'll have a minute to respond to each question. And I'm going to sort of start off with an easy softball and just ask, have any of you ever been treated at Grady Memorial Hospital? And you can just say yes or no, and if you want to expound, you have a minute to do that. And we'll just start with Peter.
No.
No, but my children have been to Hughes Spalding.
Okay.
Yes, I have.
Yes, I was born at Hughes Spalding, Pavilion and Grady, and my very first memory in life was recovering from surgery as a 3-year-old at Grady Hospital.
I volunteered at Grady as a member of the Junior League. Does that count?
I have not been treated at Grady, no.
Not yet. Okay. Do you want to begin, or shall I?
No, go ahead.
All right. So the theme, as you have maybe heard, is about HIV and its treatment and its impact on the community. And I'm just wondering, how do you all think you're going to improve the rates of infection and treatment here in your role as mayor? And this time we'll start with Kathy Willard.
Thank you for asking. You know, we have one of the highest rates of HIV infection in the world here in Atlanta, Georgia, particularly in 30310, 30311, particularly among young black men who have sex with men. It's a tragedy what's going on. I'm sure people in the audience are familiar, and we're grateful for the work that Grady does. Where Atlanta can be most helpful is within our core business, and one of those things is within housing, because people who aren't housed are unlikely to stay focused on the treatment regimen that they need to keep to stay healthy. So making sure that we're expanding the options for housing and making sure that people have housing near transit so that they can get to care is one of the most important things we can do. But also, as mayor, being somebody who's well-versed, who understands what's going on in the community, and who can speak to the community from a place of knowledge about what they need to do to take care and represent a healthy lifestyle to others is important.
I think one of the biggest ways we can have an impact is working in coordination with the CDC, with Grady, with our Fulton County partners. We have to have a singular focus on prevention. And so we've got to do things like make access to the PrEP drug more readily available to citizens all over our city. We've got to do a better job with education. You know, what was disappointing was a few years ago, Fulton County lost nearly an $8 million grant simply because of bad management in terms of helping prevent and treat HIV/AIDS. We've got to make sure that we don't lose money while we suffer from this epidemic, because we are literally, losing people when we lose that type of resource. So we've got to make sure we're going after federal grants. We've got to make sure that we're focused on housing opportunities for people with AIDS. And so we've got to make sure that we're focused on prevention. We're focused on providing more access. We're working with the CDC, and we're working with a singular focus and coordinating across multiple different jurisdictions and multiple different health partners, and focused on prevention.
I think one of the most important things that the mayor can do is to work toward the decriminalization of HIV/AIDS. The law now says that if you have sex and you are, quote, infected, that it is a felony if you do not tell that partner. What California has done is to have their law separate, where you have either the intent that it's an intent law where you intend to infect someone, because we know if you have Truvada, the PrEP, that you will not, now the studies have said that it is impossible for you to actually infect a partner. So we need to be very thoughtful, because we are having people scared of having a felony charge, and I believe that law needs to be changed.
You know, I live in historic West End. I'm raising my family in historic West End. That's 30310, one of the places where we have the highest incidence of HIV. As mayor, I'm going to speak up. I'm going to make sure that we're all working together and talking about the issue. I remember several years ago in my community, I hosted a testing event at a health club. And I was really encouraged and surprised at how many people stepped up and got tested. So when I'm mayor, I'm going to encourage folks to get tested, number one. Number two, I'm going to encourage the entire community to act as partners. We're going to engage nonprofit organizations. We're going to engage our school system to make sure that young people are getting educated about HIV very early on in their life. We're going to make sure that the city of Atlanta stands with Fulton County, stands with the hospital authority to ensure that everyone understands how serious this issue is, and that we're all working together, not only to prevent it, but certainly to eradicate it.
Before as you go on, and I'll give people who have already spoken a chance, if I could add to this, Mary Norwood's proposal, I want to, in addition to answering the question that Alexis asked, is Mary Norwood's proposal to decriminalize this passage of HIV from one to another the right approach? As you answer the rest of the question, I'd really love to hear if you're in accord with...
It's not the passage, Mr. Nygaard. It is the idea that if you're taking the drug, you cannot infect someone. If there is nothing, if you are no longer able to infect someone else. And what's happening now is people are not getting tested because they don't want to, quote, know, because if they know and they then have sex, then they are committing a felony if they haven't told that other partner.
Okay.
So it's a different.
I apologize.
No.
Thank you for clarifying.
Okay,
But
you,
let's
sir.
go ahead, Kwanzaa.
Thank you. Thank you for having me. First, I'll say there's a coordination component of this for sure across jurisdictions. There are a lot of silos, and people really are not working in as collaborative a fashion as possible, whether it be around housing or transportation, or just sharing resources and making sure we're aligning. Once we align well, we can leverage more, and I think that's definitely one component. But in Atlanta, we have something that's very, very special in light of the challenge that we're faced with as young people who are in the neighborhood I grew up in, 30311, 30310, who are infected across gender. So it's not even about just homosexual, it's about all young people. We need to use the music industry and the entertainment industry. I'm going to reach out to all of my friends in that category and have them to use their megaphones to really spread the message and to prevent young people from getting caught up in this space. This is the only way, because they have more influence than anyone in this room. Thank you.
Well, nobody can speak to health on this panel than as good as I can. Going back to your first question, Alexis, not only was I served at Grady Hospital, I saved Grady Hospital in 2008 and 2009. In terms of HIV and AIDS, we are doing some progressive things right now in terms of coordination. First point, Michael Sterling mentioned about money being lost. Most of that money was recouped. Only a small proportion went back to the CDC. Number two, under my watch as chairman of Fulton County, we created PrEP clinics, which provided the Truvada drug to folks who are infected and minimize the likelihood of transmission from one infected partner to another. Not only did we do PrEP clinics, but I also got a $100,000 grant from Kaiser Permanente to do the first PrEP clinic at a college in the United States. It was at Morehouse College last February. Number three, we were, as a county government under my leadership, we supported syringe exchanges. And then lastly, very bold and very progressive, we are promoting sex education be done in the school system, not abstinence-based education, but also in terms of safe practices.
Good morning. I'm Keisha Lance Bottoms, and thank you for having me this morning. We really can look at San Francisco and look at the model that they created. San Francisco was ground zero for the HIV epidemic in the 1990s. And if you look at the statistics today, they're less than around 200 cases a year, people diagnosed. And it really is because San Francisco has given people an opportunity to focus on their health. And that's what we are faced with, a challenge here in Atlanta. Although there's a huge gap between demographics in terms of wealth and access to health care in San Francisco than here, as a city, it really is our responsibility to coordinate with all of our partners. That's why I have committed to appointing a director of public health, not just to deal with HIV, but many of the other issues, health issues that impact our community in a very different way than many others, including high blood pressure, cancer, diabetes, et cetera. And it really is about a coordination of efforts and allowing us to let people focus on getting well.
Good morning. Again, my name is Peter Amon. Thank you so much for coming out here this morning. I know it's a bit on the early side, so thank you for coming. Thank you for listening. You all are deeply involved in these issues, I know, and we appreciate the opportunity to speak to you on them. A number of my colleagues have mentioned several ideas which are good. I would underscore the importance of housing and supportive housing for the homeless. I would underscore the importance of PrEP and access to PrEP. I would underscore needle exchange and access to needles. All of these things are important tactics. Above all else, though, as mayor, I am going to reach out and use the mayor of office as not a bully pulpit. I don't really like the term bully pulpit. I like to think of it as a pulpit of hope. We need a pulpit of hope. We need a mayor who will talk about the things that aren't always being talked about. And so in this instance, it's education, it's marketing of the issues that we are facing and how we deal with them collectively as a community.
Thank you all for not only answering Alexis's question, but I really appreciate the fact that you are doing your best and you're staying within our time restrictions. I really appreciate that a great deal. I want to move on, and I'm going to start in the middle. And I'll start with you, Kwanzaa, if I may. We know that Congress has passed a crucial deadline for refunding some community health programs that are really essential to communities around the United States, and certainly crucial here in Atlanta and Georgia. One of them is the CHIPS program. We are aware of the fact, which here we call, of course, Peach Care. We're told by the State Department of Health that there is money that will continue that program for the time being, but at a certain point we're going to lose it. But of more immediate concern, I think, to Grady Hospital is that disproportionate care payments to hospitals that deal with a great number of indigent patients who get funding from the feds to be able to handle that volume. I don't know. I wonder if there's anybody in the room. I used to have this number, know exactly how much Grady gets in those disproportionate care treatment payments. It's a lot. So, Kwanzaa, let me start with you. How do you address, if these payments are not going to be coming in, how do you address Grady's ability, how would you suggest it be addressed, to continue dealing with the indigent patients that it has to? And what are your thoughts on the fact that you have a Congress and a White House that seems to be a little unwilling to help in these areas?
Well, first I'll say, you know, in any situation, and for me as councilman for the heart of the city, there are more homeless and indigent individuals than all the council districts combined. So I tend to feel the brunt of that in a general way for all the time I've been elected. It's all about relationships, no matter what you're talking about when you're going across jurisdictions. So you wouldn't, as mayor, I would want to work directly with our Republican leadership to figure a strategy on how we make it a win-win to pull those dollars down and try to have Atlanta to be repositioned or Georgia to be repositioned. Maybe it's some other brand name they want to put on it. A lot of times with politicians and you're trying to get things done, egos are in there. So if there's a fight against one name, you have to reposition the name and figure out how to get the resources to still come your way. So it's really a lobby effort, and it's about the pork and the usual conversations that you have direct and interjurisdictional.
Thank you. Kathy, let me turn to you on that because I think that's an important point. What do you imagine your power as mayor would be to be a voice in Washington in an environment in which this is primarily a Democratic city? There isn't a great a Republican force here that can go and advocate on behalf of the city. How do you cope with a problem like that if you're mayor?
Well, thanks, Bill, for that question. I've been actually lobbying in Washington and at the state level on exactly these issues, HIV, LGBT issues, health disparity, Medicaid expansion for quite some time. And so I would just continue that work as mayor